Today I'm talking to Dr. Guy Deeming about National Smile Week. Could you tell us, month actually, isn't it?
It sure is. Yeah, it
It's
used to be
not
a
just,
week. It's now a month.
is that because we've all been hidden?
I think so. There's enough. There should be enough to smile about after coming out of the lockdown. But yeah, National Smile Month has been running in various guises for quite a number of years now, and it's really an opportunity to talk about and celebrate all the positive aspects of smiling and dental and oral health, and some of the positive things that some of the modern treatments can bring, but also reinforcing some of those incredibly important oral health messages for people who may be slightly outside the loop and may not always be encountering those in their day-to-day lives. So it's a really fantastic opportunity, and may I say, perfectly timed for the easing of
Yes.
lockdown restrictions today.
Yeah, we could all smile at each other again, or to a
Hopefully,
point, to
well,
a point.
behind our masks at least,
Yeah.
behind our masks, and indeed
So,
over a table.
so you've done some research. What is the research show?
So the National Smile Month team looked at around about 2,000 adults, and Ben Atkins, I know, is coming on the call in a little while, and they found some incredibly powerful findings, actually, that, the last year has been incredibly difficult for lots of us, but in particular, the way we've been engaging on virtual calls and Zoom calls has had an impact on how people perceive and feel about their smiles. So, for example, nearly a third of people have become more aware of the color of their teeth. A quarter of people are more concerned about the alignment of their teeth. And many of those are now going on to think about doing some things to invest in themselves to improve those aspects of their well-being that they can. Now they become more aware of them through things like Zoom and virtual calls and working from home and so on and so forth. So it's a really important aspect of people's appearance and confidence, which has been forced to the forefront of their minds over the last 12 months.
And I don't know who wants to answer this, but have we been neglecting our teeth during lockdown, or is it just we've just put it on hold?
Hi, yes, it's Ben Atkins here from the foundation. What we're finding is a lot of adults have been snacking a lot more frequently. So our diets have worsened over the lockdown period. So it's really important you visit your dentist for that checkup after we all come back out again. Reduce the sugary snacks and increase our brushing, probably to twice a day, because our habit patterns have changed. I don't know about you, but my children have been a challenge to get into the bathroom sometimes with their brushing.
Yeah, yeah, they're not maybe not quite as good at it. And when it comes to us all revealing ourselves from our masks, I mean, my sister, for example, she lost a tooth during lockdown, and she's had to wait a long time to get the process going for some implant or something. Is that going to happen? Are there going to be sort of waiting lists for treatment?
I can talk from the general practice side, but I'm not sure about the orthodontic side with Guy. But practice waiting lists have increased, and we're seeing it's a challenging period coming out of lockdown. The teams in practice are working so hard with all the legislation changes and all that sort of. The dental practice is a phenomenally safe place to go, which is why we've been open all the way through this second lockdown.
Mm-hmm.
Guys, I'm finding that my patients are understanding, they're waiting, they're talking, but the biggest advice is to speak to your practices, find out when they're going to be able to see you, and work with those practices really closely.
Yeah.
The dental team, I'm phenomenally proud of how they've come through this lockdown. What we're finding is it's really important to increase that preventative message with our patients. They've evolved slowly. I don't know about you, Guy, with the orthodontic world.
Very, very similar. I mean, dental and orthodontic practices were safe before, they were extremely safe during, and they will remain safe afterwards. And my perspective has been that it's been really challenging with large numbers of patients in active treatment. There has been delays, but we are, as a profession, getting through those now.
Mm-hmm.
My patients have been fantastic. They've been incredibly patient and understanding. And of course, I don't imagine that will change. But the key thing for me is to communicate. So keep in touch with the practice, follow your practice on the various social media feeds if they're active, check on the websites, and just keep communicating. Mm-hmm. They've got an awful lot to do, so don't necessarily rely on them contacting you. So if you're concerned, give them a call, drop them an email, because they want to help. But we need to recognise that there are some challenges over the short and possibly medium term to catch up.
Yeah, you mentioned social media there, and there's sort of a thought that people are actually going to social media for tips and things about their teeth. Is this right? And what would you say about that?
Well, it's obviously social media is been big news for the last decade or so, and it's obviously it pervades into dentistry and certainly cosmetic dentistry. And the advice would be always consult a professional. Now, there are lots of professionals active on social media. Ben is one, who give incredibly good advice, but you need to look at the credibility and experience of those individuals, because on the flip side of that, there's a lot of people who are maybe working as Instagram influencers, which is nothing wrong with in itself, but that needs to be declared and that needs to be understood, because they may be offering advice that isn't supported by the best options for you or a full clinical examination and all of those things that would underpin any sort of healthcare or any sort of treatment.
Yeah. And as a sort of a final roundup, what would both of you, Dr. Atkins and Dr. Deeming, what would you suggest as your tips for people now and going forward?
For me, there's two areas. There's the preventative journey, and visiting the All Health website, which is a fantastic place to find more information on Smile Month and also preventative journeys. For me, there's a bit of a zoom boom on the aesthetical side of the teeth, which is more of a guy's world. I'm just more of a decay old man with dentistry. Guys in the modern world of the Invisalign straightening teeth world. So what's your thoughts about the aesthetical world, Guy?
I think that from a kind of final point, I guess it's, if it looks too good to be true, it probably is too good to be true. So there's a lot of stuff that's being talked about online and promoted online, which makes it look either easy or quick or cheap. And the sad truth of it is you can't have all three of those things and get a great outcome. And like lots of things, you need to start with the end in mind. What are you actually trying to achieve? And then work out the right way to get there. Because sometimes it may not be as easy or as quick, or dare I say, as cheap as you might think. But the most important thing is you end up in the right place and are not wooed by something that looks fantastic and super straightforward and super easy on the internet.
And it could waste your time and money, couldn't it?
Or worse, it could do you active harm. Certainly,
Right.
We see people going outside of the UK for treatments, coming back to the UK with all sorts of problems. And these are the sorts of things that we really do want to protect people from, to make sure that they're getting the very best care for them.
But at the end of the day, you'd say, keep smiling, would you?
Of course, at least for the next month.
Yeah, okay. All right. Well, thank you very much for that. Thank you.
Thank you.
Bye then.